Let's talk about what you need to know about out-of-pocket costs or what you're required to pay for based on the insurance plan you choose. A premium is a monthly fee charged by an insurance company for coverage. The type of plan you select will impact the price of your premium. For people who get their insurance to their job, their employer will determine how much of the premiums employees must pay for coverage. Here's an example of how a premium works. Mary has group insurance through her employer with pre-tax premiums. Every pay period, her share of the health insurance premium is deducted from her paycheck before taxes are calculated to cover the cost of her health insurance. Many people have deductibles, which is the amount of money you must pay out of pocket every year before the insurance company will start paying your claims. In this example, John has a health plan with a $1,000 annual deductible. John falls off his roof and has to have 3 knee surgeries. Yikes! John's first surgery cost $800, and because he hasn't yet paid anything toward his deductible this year, and because the cost of the surgery doesn't meet the $1,000 deductible, John is responsible for 100% of his first surgery. If we're doing the math, a $1,000 deductible minus $800 for the surgery leaves John with $200 left to pay on his deductible for the year. But don't worry, John's okay. There is also something called a family deductible. Because most family health insurance policies have both individual and family deductibles, every time an individual family member pays towards his or her individual deductible, the amount is also credited toward the family deductible. Once the family deductible is met, everyone in the family is covered even if their individual deductibles are not met. In this example, the Griffins have a family deductible of $1,500, but each member of the family has an individual deductible of $500. Mom has paid $500 for medical services so far this year, and the rest of the family has paid $0. Benefits will kick in for all of Mom's future claims for the year, but not for the rest of the family yet. Jess, Stevie, and Dad still have $500 each to meet on their individual deductible, and there is $1,000 left on their $1,500 family deductible. Unfortunately, both Jess and Stevie get very sick over the next few months. Based on medical services received, the Griffins had to pay $500 for each of them. Combined, Mom, Jess, and Stevie have paid $1,500, which means they now have met their family deductible. So even though Dad hasn't paid anything toward his individual deductible, all of his claims will be covered for the rest of the year. A copayment, or copay, is another out-of-pocket expense. This is a fixed amount you pay for covered health service. The amount typically varies by the type of covered service. For example, a copay for a primary care doctor is usually less expensive than a copay for a specialist. In this copayment example, Sally takes her son to the pediatrician for a bad cough. She has a copay of $15 for primary care. The cost of the visit is $200, but Sally is only responsible for the $15 copayment. The insurance company is billed for the rest of the charges and will pay the remaining $185. Coinsurance is your share of the cost of a covered health care service calculated as a percent of the allowed amount for the service. In this example, we revisit John and his knee injuries. John's second surgery occurs in the same plan year as his first surgery and costs $3,200. Because he has only paid $800 toward his $1,000 deductible, John is responsible for the first $200 of the second surgery. After that, he has met his deductible, and per his plan, the insurance carrier will cover 80% of the remaining cost, a total of $2,400. John is still responsible for the remaining 20% of the cost, or $600. So between the remainder of his deductible and the coinsurance, John's out-of-pocket cost for his second surgery is $800 total. An out-of-pocket maximum, or OOPM, is the most you should have to pay for an annual healthcare service, including your monthly premium. After you have reached your annual OOPM, your plan begins to pay 100% of the allowed amount for covered healthcare services for the rest of the year. Some plans do not account all of your out-of-pocket expenses towards your OOPM. For example, some plans do not count your deductibles towards your out-of-pocket maximum. Let's use John's third knee surgery as an example, which happens to occur in the same plan year as his first 2 surgeries and costs a total of $8,000. John has already met his deductible, so he only needs to pay the coinsurance on this surgery up to the plan's out-of-pocket maximum of $3,000. Because John has already spent $1,600 towards his OOPM on his previous surgeries earlier this year, he only needs to spend $1,400 before he hits his out-of-pocket maximum. We're getting ready to wrap up. Hang in there a while we talk about participating providers, preventive care, and a few final terms related to costs.